Good morning, student. Today we will discuss about sports injury and its management technique. Sports injury are those injury that occurs during participations in sports. Sports injury, it is of two types, soft tissue injury and hard tissue injury. Soft tissue injury, it is of two types, skin injury and muscle injury. Skin injury are those injury that occurs over the skin like contusions, abrasions, lacerations, incision, etc. Hard tissue injury. Hard tissue injury are those injury um, that hard tissue injury, it involve damage to bones of skeletal systems like fractures, dislocations, etc. Injury, it injury are further classified as minor injury and major injury. Minor injury are those injury that does not affect much to the fitness of a players. It does not affect performance of a players. It is less painful and vanish after some times, like contusion, abrasions, incision, etc. These are the minor injury which does not affect performance of a players. Serious injury. Serious injury, it affects the performance of a players. It is very painful, like fractures, dislocations, ligament tear, etc. Management of soft tissue injury. Contusion. Contusion, it is a soft tissue injury caused by severe blow or impact by external object without breaking the continuity of skin. Means contusion, it is the injury over the skin. Okay, contusion, it is the injury over the skin caused by direct hit by an external object without breaking the continuity of the skin. The continuity of the skin is not break. There is no bleeding, but the color of the skin changes. It may be red or blue. There may be swelling, sometimes loss of functioning of the affected part. There is in contusion, there is internal bleeding. Okay, there is internal bleeding, due to which the color of the skin changes from red to blue. Its first aid and management technique. The first treatment of contusion is icing. Contusion should be treated immediately with ice applications for some durations after some intervals. For 2 days, do a icing. Okay, do icing. If there is any bleeding, use antiseptic cream. Apply cold compressions after every 6 hours for 2 days. The icing should be done for 2 days, and after 2 days, massage should be done over the affected part to reduce the swelling. Abrasion. Abrasion, it is the injury on the surface of the skin. In abrasions, the skin is scraped or rubbed by frictions, that is rubbing of skin over the rough and hard surface. Okay, the abrasions, in this the skin is rubbed by a frictioners. Abrasions, in contusions there is no bleeding, but in abrasions it is bleeding. There is a bleeding over the affected part and it causes severe pain. It usually occurs over knee, elbow, palm, etc. First aid. First treatment, the first step is avoid further frictions. Clean the affected part with some antiseptic cream. Wash it properly. Okay, wash it properly and use some antiseptic cream over the affected part. Laceration. Laceration, it is a type of wound or cut that happen when the soft tissue in the body are torn by a blunt object. Okay, laceration, it is caused by a blunt object like hockey stick. When someone hit you with a hockey stick, the skin may be torn, it may be cut. Incision, it is also a type of wound, but it is caused by a sharp-edged object like knife, razors, etc. In this, sometimes the arteries and veins may be cut and blood usually come out freely from the incision. Okay, incisions, lacerations and incisions both are wound, but lacerations, it is caused by a blunt object, and incision, it is caused by a sharp edged object. First aid and management technique. First, clean the surface with some antiseptic cream like Dettol. After that, stop bleeding at the earliest by compressions, by compression or by pressing or put compression bandage to stop the bleeding. After that, cover the affected part with medicinal cotton bandage or apply bandage. Repeat dressing and apply ice or cold compressions. If the injury is deep, go for stitches at earliest. Avoid further infections by putting medicine cream over it, and proper care should be taken till the injury is totally healed up. Muscle injury. Muscle injury, it is not really dangerous, but it is the wrong treatment which causes problem. The muscle has the ability to repair itself very quickly if we take proper treatment step of muscles, then it may be healed. The treatment for muscle injury is rest, ice, compressions, elevations and rehabilitations. Cramp. It is the inability of muscles to contract properly, causing severe pain over the affected part. Okay, when the cramp happen, the muscles is unable to contract properly. The cause of cramp may be due to overstretching of muscles, or if there is loss of waters by sweating, doing exercise without warming up, then doing warming up without exercise, doing heavy exercise, doing exercise in extreme bad weathers or climate, etc. These are the cause of cramp. Okay, cramp means the inability of muscles to contract properly. The muscle is unable to contract properly. It is due to overstretching. It causes due to overtraining. If you do overtraining, if there is loss of waters, loss of salt and minerals from the body, doing physical activity without warming up, etc. The management technique, first aid and management technique for cramp is: first, do a complete rest, okay, and second, drink sufficient waters, and if possible, drink lemon waters or juice. Massage over the affected part after some times. If the pain is more, apply ice. Ice have to stop the internal bleeding. Prevent overexertion of muscles in excessive hot or cold climate. Strain. It is also known as muscle pull. Strain, it is a muscle injury. Okay, strain, it is a injury in which the muscle fibers is damaged or tear. It is caused due to overstretching of muscles. If the muscle is overstressed or or due to violent pull, it causes strain. Okay, strain, it is in strain the muscle fibers get damaged or break. It is caused by overstress or overstretching of muscles or tendons, or due to violent pull. Strain, it causes acute pain, swelling over the affected part, sometimes loss of functioning of the injured muscles, etc. It can be prevented by doing proper warming up, avoiding jerky movement, etc. Management technique, first aid and management technique of sprain. The treatment is rest, ice, compressions, elevations, and rehabilitation. The first step is rest, complete rest. Complete rest to the place, restrict the movement of the affected part, no movement. Okay, complete rest. After that, use ice. Immediately apply ice over the affected part. It helps to stop internal bleeding. Repeat this process for several times after some interval of time for 2 days. We should do icing for 2 days, and it should be done after some interval of time, like do icing for 20 minutes and 30-minute break, again 20-minute icing, 30-minute break, etc. Compression bandage should be applied over the affected part to reduce swelling. Elevate the affected part above the heart levels with the help of splint or support. After 2 days, apply some inflammatory cream to reduce swelling. Give gentle massage or use contrast bath like hot and cold bath to reduce swelling. After the treatment is over, do a rehabilitation exercise to regain the strength of the muscles, or do a physiotherapy to regain the strength of the muscles, and it should be performed in a progressive manner under the expert observation. Okay, next is sprain. It is a ligament injury. In this, the ligament is tear or damaged. It caused due to overstretching of ligament. If the ligament is overstretched, or due to twisting of joint, then our ligament may be tear. Okay, in strain, the muscle is tear, the muscle is damaged, but in sprain, the ligament is tear, and the ligament is tears when the ligament is overstretched. Okay, due to overstretching of ligament or due to twisting of joint. It causes severe pain, swelling, restrict the movement of the joint. The movement of joint is restricted, not possible, and there is swelling, as there is lot of internal bleeding. Okay, there is lot of internal bleeding. Sprain, it usually occurs over ankle, knee, elbow, wrist, etc. It can be prevented by performing warming up and avoiding jerky movement. Its management, first aid and its management technique. First step, rest. Proper rest to the place. Complete rest, restrict the movement. There should be no movement, complete rest. After that, immediately apply ice over the affected part to stop the internal bleeding. Compressions, apply cold compressions or ice to stop the internal bleeding Repeat this process for several times. Compression bandage should be applied over the affected part. Okay, look at here. Like here, first the first step is complete rest. There is complete rest, no movement. After that, use icing. After that, use icing. Icing helps to stop the internal bleeding, and it should be done up. It should be repeat the process. Repeat icing for several times after some interval. After that, compressions. The compression bandage should be applied. Okay, compressions to stop to reduce the swelling. Elevate the affected part above the heart levels. Okay, it should be elevate over the heart levels with the help of some support or splint. And after the rehabilitations, elevate and rehabilitations. After the treatment is over, do a rehabilitations exercise or physiotherapy. It's in a progressive manner to regain the strength of the joint. Okay, we do rehabilitation exercise to regain the strength of the joint and muscles, and it should be performed in a progressive manners under the observations of the expert. Management of heart tissue injury, that is bone injury. Bone injury, it is a serious injury and very painful. A bone injury is not handled properly, it may lead to permanent disability, and if it leads to disability, then it is permanent. Okay, bone injury, it is very serious, therefore it should be handled only by an expert doctors. And the first step of bone injury is immobilize the affected part, no movement. After that, to stop the internal bleeding, internal or external bleeding, use ice therapy. Use ice. Restrict movement, no movement, and apply ice to stop internal bleeding. Bone injury, it is classified into two types, dislocations and fractures. Dislocation, it is the injury of the joint in which the adjoining bones are displaced from their original position. Okay, in dislocation, the adjoining bones are displaced from their original positions. It may be due to direct hit, direct or indirect impact over the joint. The symptoms of dislocations, it is severe pain. There may be severe pain around the joint. The joint look the joint not look normal. Okay, it will not look normal, and there is a swelling over the affected part. The joint will appear fixed. The movement is not possible in the joint, and the temperatures increase. The temperatures of a person increase. The management technique, the first aid treatment for dislocation. The first step is do rest, complete rest, no movement. Do not move the joint. The victim should be kept in a comfortable position. After that, use ice therapy to reduce the internal bleeding as well as swelling. With the help of icing, if you ice, it reduces the pain of the injured persons. Okay, it helps to reduce the pain of the injured persons as well as reduce swelling and internal bleeding. After that, provide support by using string or splint bandage. It's helped to avoid further movement and also relief from the pain. and the patient should be handled by the expert doctors. We should hospitalize it and do X-ray, and other diagnosis should be done properly. The immobility should be done for 3 to 6 weeks as per the doctor advice. After the treatment is over, the rehabilitation exercise or physiotherapy should be done to regain the strength of the joint and muscles, and it should be done under the observations of the expert in a progressive manner. Next is fractures. Fractures, it is the injury in which the bones is break by some external pressures. Okay, there may be slight breaking or complete breaking of bones by external pressures. Fractures, fractures, it is categorized as closed fractures and open fractures. Closed fractures, in closed fractures, the broken bones remain inside the covering of the skin. There is no cut over the skin. Open fractures, in open fractures there is cut over the skin by the sharp object like the broken bones or by the external object. Okay, in closed fractures, the broken bones remain inside the covering of the skin, and in open fractures there is a cut over the skin by the sharp edge of the broken bones or by the external object. Fractures, it is further grouped as complete fractures. Complete fractures means the bones totally break down into two pieces. Okay, in this the bones is totally break into two pieces. Incomplete fractures means there is only cracking or partially breaking of bones. The bones is not completely break, there is only crack or partially break. Greenstick fractures, in these fractures the bone is bent with mild cracking. The bones does not break completely. Okay, the bones is bent and there is a mild cracking over the bones, and it is usually seen in the child bones. Okay, it is usually seen in the child because their bones are delicate and can bend. Comminuted fractures, comminuted fractures means in this the bones break into many small pieces at the site of fractures. Okay, at the site of fractures the bones break into small pieces. Impact fractures, in impact fractures the broken bones driven into another's broken bones, or when the broken and protrude into another bones means the fractures bones enters into another bones. Okay, in impact fractures the broken bones enters into another's broken bones. Transverse fractures, in transverse fractures the breaking of bones at right angles with the axis of the bones. Okay, transverse fractures, in transverse fractures the fractures lines run horizontally due to direct blow when the fractures is from one side to another's, and the bones break at a right angles. Stress fractures, it is also known as hairline fractures. Stress fractures, it is due to repeated stress over the time. The bones is pressed from a corners and it causes partially damage to the bones, and it usually occurs in jumping event. Okay, due to repeated stress over the joint. Oblique fractures, the bones break diagonally. Okay, in oblique fractures the bones is break diagonally. Compound fractures, and compound fractures, the breaking of bones. There is breaking of bones plus dislocations. Okay, breaking of bones along with dislocations. Complicated fractures. In complicated fractures, the bone is crushed, as well as it affects the delicate organs like brain, heart, livers, kidney, etc. are damaged by it. These are the types of fractures. Complete fractures means the bones break completely into two pieces. Incomplete fractures means there is only cracking or partially break up of bones. Green stick fractures means bones is bent, as well as there is a mild cracking of the bones. Comminuted fractures. In comminuted fractures, the bones break into many small pieces at the site of fractures. Impact fractures. In impact fractures, the broken bones slide over the another's broken bones. Transverse fractures. In transverse fractures, the bones break at right angles. Okay, the bones break at right angles with excess of the bones. Stress fractures, it is due to repeated stress over the time at the joint. The bones is pressed from the corners and cause partial damage to the bones. Oblique fractures. In oblique fractures, the bones break diagonally. Compound fractures. In compound fractures, there is breaking of bones along with dislocations. Complicated fractures. In complicated fractures, the bone is crushed, as well as the delicate organs like brain, heart, kidney, etc. are damaged by it. Symptoms of bone injury. Bone injury, that is both dislocations and fractures. In this, there is severe pain around the fractures. The joint or bones, it does not look normal, and there is a swelling over the affected part. The joint will appear fixed, no movement. The movement is not possible at the site, at the affected site. The temperatures increase and the fracture parts are deformed. It will not look normal and the movement is not possible. First aid and management of bone injury. The first step is immobilization. Okay, do not move the joint or bones. Complete rest. The victim should be kept at a comfortable positions and no movement. Immobilize the joint or bones. Apply cold pack. Apply ice. Immediately apply ice over the affected part to reduce the swelling and internal bleeding. Provide support by using string or splint bandage. It's help to avoid further movement, as well as it give relief to the victim. And the patient should be handled by the expert doctors, and X-ray and other diagnosis should be done properly. The expert should manage immobility by applying plasters so the joint take its real position. The immobility, it should be done for approx 3 to 6 weeks, and after the full treatment is over, do a rehabilitation exercise of physiotherapy to regain the strength of the joint or bone. Okay, we do the rehabilitations of physiotherapy in a progressive manners under the observations of an expert. Okay, with the help of this we regain the strength of the joint or bones. This is about the sports injury. Sports injury means those injury which occurs in sports during participation. Sports injury, it is of two types: soft tissue injury and hard tissue injury. Soft tissue injury, skin injury, and muscle injury. Skin injury like contusions, abrasions, lacerations. Muscle injury like sprain, strain, cramp. Hard tissue injury like fracture, dislocation, etc.